from a plastic surgeon's point of view. Welcome, Dr. Marwan.
Thank you very much. Assalamu alaikum. I'm going to speak today about a topic which is very common in our region, which is post-piercing and keloid formation. So the ear is the common location for the development of the keloid, and we have a few triggering reasons, which is the piercing or any type of injuries on the ear. We have to differentiate between the piercing bumps and the keloid. In the piercing bumps, we have a small lumpy area on the piercing side, sometimes follows with inflammation if it is related to the piercing of the cartilage also. And these type of bumps increase if the patient has any body immune system response. But in the keloid, it's totally different because the scar will rise up post-piercing or any type of trauma to the ear, and it causes overgrowth of the fibrotic tissue, and it increases the fibroblast production, and in the end will produce a very ugly scar which will be elevated. And in the beginning, it starts with itchiness, with redness, and slowly it increases within 3 to 12 months post-injury. And the texture will be changed. Initially will be very soft. In the end, will rise up and will become harder. The incidence, true incidence, it's unknown, but in the dark skin is more than in the white skin. We have in all age groups, but commonly between 10 to 30 years old. Common sites are the ear loops, deltoid areas, sternum areas, and the back. Less common sites are the eyelids, perineum, palms, and the soles. We have different type of stages or the types of keloids on the ear. We have the early stage, which is, it shows as in the picture with the very small bumps and producing pupil, and the surface of the area is very soft and almost the same level of the skin or the ear loop, with very mild elevation and small inflammation around it. But then we have another type which calls the nodular or the tumor ear keloid. And the first one, as you see on the left side, is early stage nodular ear keloid with elevation, bumpy nodulars. And in the center, we have a mixture between the nodular and the tumoral ear loop keloids. And in the last one is the tumoral ear loop keloids. These type of, let's say, scars, it's not recommended to remove it surgical, because I know some of our colleagues, they remove it surgically, but it's not indicated. You have to prepare the patient before doing any surgical procedure. And then we have the semi-massive ear keloid. This measure larger than the half of the ear, but not larger than the size of the ear. And then we have the massive ear keloid. These type of keloids, we don't see it here. It's very rare. And we see it only on the dark skin type 5 and 6. Prevention, it's very important we speak about that. So we try to avoid any injuries on patients who are prone to get any type of keloid formation. Try to avoid the piercing on the cartilage and avoid incision in keloid-prone areas. Elective incision along relaxed skin tension line, so that when you are excising, make sure that there are no tension. And the surgical technique must be meticulous. good wound healing, because if you have an open wound, it may have a more prone for scar formation and elevation of the scar. The treatment of the keloid, there are so many modalities in the region and internationally. This recommendation is from the American Society of Dermatology. They recommend corticosteroids, surgery, laser treatment, cryotherapy, and I know there is also radiation therapy. We try to avoid the radiation therapy because there is a high risk, or let us say 1% risk for skin cancer formation. So what I do in my practice, I have been practicing doing treatment of these keloid scars for more than 20 years. And from my experience, especially with the ear keloids, I dilute the 40 milligram Kinalog to 20 milligram, and I inject in the scar once every 2 weeks. I know that the recommendation is every 3 to 4 weeks, but most of my colleagues, they inject higher dose, higher concentration on a longer time period. I give a little bit lower on a short time period because everybody says that the effect of the cortisone, it's between 1 week to 10 days. And later on, the effect starts to be less. So I would like to give less concentration, which is 20 milligram, but I never go to 10. And then I give them within every 2 weeks. And then in between the sessions, I encourage the patient to use the Dermovate cream application twice per day and continue that until the partial regression, because in the first session of injection, the patient will notice that the itchiness starts to disappear or reducing. And then when you continue, in the second session, total itchiness will disappear. And then in the third one, the lesion will become softer. And then in the fourth one, it will shrink. And then once you go to the fourth session, you have 1 week to remove it surgically. And this is what I will show in my cases. I use the CO2 laser treatment. So once I reach to the fourth, sometimes to the fifth, once I inject, I tell the patient within 1 week you have to come back. I have to use the CO2 laser to remove this. And then the scab formation, which is going to be on the area, I encourage the patient to use the Fussicort cream twice a day. And then I do a close follow-up and observation, because internationally says, and I noticed that also, that within 1 year, there is a risk of recurrence of the keloid scar. So you have to detect it early and start the treatment as early as possible with laser, for example, PDL laser sometimes I use, and sometimes with Dermovate, and sometimes I use a very mild CO2 laser resurfacing if needed, if I see any recurrence. So the reason that I use the CO2 laser is because it's bloodless and surgical precision. It's like a blade which will remove anything you want without any bleeding. And you control the depth of your procedure. In this first case, if you see in the left picture, you have the nodular, and then the second picture, I remove it with CO2 laser, and then you can see the result after it's about 2 to 3 weeks. And this is the second case. It's nodular tumoral, and she has it on both sides, on both ears. So I treated both sides, but unfortunately, I don't have the current picture, the final result. And this is also tumoral. You can see the first picture, and then I removed it with the CO2 laser. In the third picture, you can see after the removal. You have to remove the whole lump, but make sure you will not reach to the cartilage. If you reach to the cartilage, the recurrence risk will be higher, because you will cause infection, inflammation, and recurrence of the tumor or tumoral shaped keloid scar. So you have to remove it with preserving a very thin layer of the tissue around the cartilage, and then you can see the result in the end. Here you can see also in both sides of the ears, which is removed. And this is the last picture. Thank you very much.